See, you have a platform to create a center just like we did for cardiac surgery. You don't have to worry about generating any revenue. That was his brief was very clear. We have an engine with many bogies. Adding one more bogie is not going to be a problem. Don't worry about the costing. Offer surgery free of cost. Very quickly around that time, the Yashaswini scheme was there. The Yashaswini scheme was implemented. We had an MRI, and Dr. Devi Shetty offered the MRI 100% free of cost to all patients from the Yashaswini scheme at that time. But that started a catalytic process of our early 0 to 20,000. Very soon, the hospital also realized a few things. That with this amount of investment that we did, slowly we could do quality work, and the hospital not only would generate enough income. Now, Dr. J.B. Shetty had a vision of building a similar facility for neuro at that time, but within a year or so, his vision transformed to say, why not start other specialties also? So the success of neurosurgery led to the seed for multi-speciality in the cardiac hospital, and that's how we have the model of the cardiac hospital here and elsewhere. If you have to give quality, it requires doctors to be around the patient all the time. And world over, this is possible only through a residency program. One of the initiatives, again taken by Dr. Devi Shetty right for us in the beginning, is to start a neurosurgical training program. And today we have one of the very successful neurosurgical training program, and we have students in important positions all over the world. And in the very recent examination, our examiners were comparing students with Nimans and with Narayana, and they said your students are not only par, they are much better than what they are. I'm extremely happy to have a great landmark and this could not be possible if not for the wonderful team that I have been. Many of our neurosurgeons whom you are going to meet today have been there from the very inception, who have been there from the time when I told you about the difficulties, who have been staying in hospital day and night to be able to take care of the patients.
In pediatric neurosurgery, and that is what stimulated my desire to set up a dedicated pediatric neurosurgery unit within the neurosurgery department. And after joining Dr. Timmapa Hegde's team in Narayana, so I fortunately had this opportunity to work with small children who had neurosurgical problems. And what we quickly realized is that children are coming to us quite late. The references are not coming because the fear even amongst the doctor community was that these small children may not be able to tolerate surgery. And what we try to do over the years is, especially in children with congenital problems in the spine and in the head, if we can operate them within the first few months, we have much better outcomes. And that is what we have been successfully able to do over the years. And with increasing use of technology, this surgery has become safer over the years. Other than problems which children are born with, we also have problems which happen afterwards, such as unusually children can have strokes. And one of the most challenging surgeries in these small children is to do a bypass surgery in the brain itself. And that fortunately for us also has been quite successful over the years. Epilepsy is a problem which can devastate the brain. If a child's epilepsy cannot be controlled with tablets, medicines, then surgery in some situations is an option. And that again should not be delayed. So it is very important for people out in the community to realize that problems like this, if identified early, can be treated, even in small children, with good success. Fortunately for us, in Narayana Health, we have a very good oncology center. And the team of medical oncologists, radiation oncologists, combined with the neurosurgical team, can operate on tumors in small children, both in the brain as well as the spinal cord. And we have numerous success stories of such children. Tragically, some of these tumors are also malignant and cancerous and may not survive long. But we have had the privilege of supporting the family, helping them through these difficult times. And that is something we are proud to be part of also. So thank you for being here.
We have had about 10,060 cases cranial, 9,321 cases spinal, and 1,207 peripheral and other functional cases. So breaking down these statistics, annual figures year-wise, we have seen gradual increase in cases till 2018 and 19, and it was the COVID time when there was a dip in 2020, and now it is still further moving on to pre-COVID status. So this is how the count of cases went on year by year. Month by month, gradually the cases increased. We achieved initial 5,000 in 6 years, and recently we have achieved 5,000 in 4 years, last 4 years. So 20,000 cases and counting. So this is among the major cranial cases. We have operated brain tumor cases 2,357, vascular cases 449 cases, and neurotrauma, both cranial as well as spinal traumas, 2,392 cases. So these are the breakdown of all the spinal tumor, brain tumors and skull-based neurosurgeries. So various types of surgeries what we have been doing. We are all skilled with the equipments, the microscope, neuronavigation, the intraoperative, ultrasound, X-rays, C-arms, and all that required for state-of-art OT and neurosurgical practices. So this is breakdown of all the glioma cases we have been operating. So we have operated in the last 20 years. This is meningioma, a tumor which comes from the covering layer of the brain, the dura mater. CP angle tumor is tumor in the posterior fossa, backside of the head. So these are the number of cases year by year we have done. Pituitary is a gland situated in the skull base, and we have operated these tumor endoscopically through the nostrils. So we put an endoscope into the nostrils and approach, and then we do the surgeries, decompression of tumor. Vascular cases, we have AVM, carotid endarterectomies, glomerulars, moya cases, cavernomas and aneurysms. And aneurysms, so far 242 cases we have operated with all success stories with us. This is breakdown of vascular cases, aneurysms and AVMs in the last 20 years. Of course, aneurysm cases are much more than AVM. Coming down to spinal surgeries, we have lumbar discectomy, hoofing 3,779 cases. And of late, we have started minimally invasive surgeries also, wherein keyhole surgeries with a very small incision have been performing. So, lumbar fusion, dorsal fusions, various types of spine tumors, trauma cases have been going on. So, coming on to the cervical discectomies. So initially cervical decompressive laminectomies were being done, and gradually we have shifted over to lateral mass fusions as well. Lumbar discectomy cases have been the majority among spine cases. So this is the statistics, and we see a dip during COVID times, and gradually the numbers have been increasing. Lumbar fusion cases have been increasing, so we have started doing even minimally invasive cases these years. So this breakdown of spinal fixation surgeries, we have done good number of ACDFs and anterior cervical fusions, also posterior approach to the spinal cord, like lateral mass fusions, and also operated on dorsal as well as lumbar spine. So disc degeneration, cervical has been quite common. Lumbar discectomy, very commonly done, 3,779 cases. Coming on to the junction of head as well as the spine, this craniovertebral junction, what we tell. So occiput C2 fusion and C1 C2 fusions have been great number, and these numbers are at par with any of the national institutes in India. So IDEM, spinal tumors we have operated quite a whopping number we have. Intramedullary tumors are a type of spinal tumors present within the spinal cord. Good number of cases we have done. So this is ear-wise spinal tumors. Pediatric cases also, as Dr. Shibu was mentioning, various types of pediatric cases, brain tumors, VP shunts for hydrocephalus, hematoma evacuations, trauma cases, ETBs, encephalocele. Spina bifida has been a majority in number with 367 cases so far and counting. Cranial synostosis is again something to mention because many of the institutes, many of the hospitals do not do this kind of surgeries. Functional neurosurgeries has been a very major part of our OT also. Epilepsy surgeries, deep brain stimulation, of late we have been doing frequently as well. Microvascular decompression we have done quite a lot.
The situation was quite serious, but after that we had to do a 9-hour long surgery. Post surgery, I remember that Dr. Komal Prasad and Dr. Timmapa Hegde telling my parents that this will be a really long and quite tough road back to recovery, but due to their doctor's care and also a huge shout out and a huge thanks to the oncology department at Narayana Health. Because this tumor was malignant, I had to undergo chemotherapy for 2 years, and I also had to undergo physiotherapy for 1 year because I was actually bedridden and I was on a wheelchair, and from there I had to learn how to stand, learn how to walk, and learn how to run again. The biggest support I've had is that the doctors kept saying that it will be alright, and that is what has pushed me forward, and I've successfully come out of both those issues. And today I'm in SJCC, I'm in St. Joseph's College of Commerce, and I'm doing my BBA. I wrote a book called It's Not That Hard, and this is a true, it's like a true testament to say that nothing is hard in life as long as you have the right people with you, which I did due to the brilliant doctors and their care.
Sir, come closer. Close buddy. So both are very important questions. So those are the points where we stress. Most of our patients are from rural background, and also there are ways in which it's made affordable each and every person. This is a new technology available. We can't take this technology to the footsteps, but indirectly we do this using telecommunication, outreach clinics, from where these people who require this advanced technology are brought to our center, and that's how we make it available.
Okay, sir, now majority of the government of India is trying to spend crores and crores.
From its inception, we are the pioneers in the micro-insurance scheme, and from those days we are following it up. Whenever the new scheme comes, it's based on it.
It's very challenging. One of the most difficult things is because the children have very little blood in them. So even a small amount of blood loss can be seriously life-threatening. So the aim is to do it slowly, carefully, so that minimum amount of damage happens and the child is safe. More than that, I would also, answering your previous question about cost.
Yes, sir.
With children, it is very critical, because often what happens, these small babies, they will have young families. The families are just beginning. Their income is very little. So even a middle income person may not be able to afford these things. And looking after children is the responsibility of the entire city or the community. So there is an African saying that it takes a village to take care of a child. So all of us have to take part in bringing these children to safety. Whenever the family lands in trouble with a small child who is ill, we have to all contribute to that. You may often see requests for help, and whoever can do whatever small amount of help, that will be important to save a child.
Many of them come from rural Karnataka. Fortunately, there are various government schemes for BPL patients. And if you ask them, most of them don't have to pay anything. So because of these schemes, we are able to offer the best of healthcare to really, really poor people. Additionally, we get a lot of patients from Bangladesh. Bangladesh has been one country where we get so many patients. And even all of them, they are also very poor. The beauty of this hospital, and this is the vision of Dr. Devi Shetty, when they come to our hospital, within whatever budget they have, and we have a system, somehow they are able to manage the cost, and patients are not refused treatment just because of their inability to pay. And that vision has been working for us. Right.
We have to start a unit in Mysore, the Neuro-surgeries, same countries. To answer your question of how we reach people in other places. And your other part is about other countries. We have one unit in
ಅವ್ರನ್ನ ಮಾತಾಡ್ಸಿ ಇದು ಡಾಕ್ಟರ್ಗೊಂದು ಗ್ರೇಟ್ ಮಾಡು ಒಂದು ಸೆಕೆಂಡ್ ನೀವು ಹಂಗೆ ಮಾಡಿ ಮಂಗೇನೆ ಎಲ್ಲ ಮಾಡಿ ಸರ್ ಹಂಗೆ